Sizing and placement of the posterior mouthpiece involves measuring the interincisal opening of your patient. Have them open their mouth as wide as they can comfortably, not too wide that they're uncomfortable, and we're going to use that distance to determine the size of the mouthpiece. We'll use the finger method. One finger will be either pediatric or extra small, 2 fingers will be small, 3 fingers will be medium, and 4 fingers will be large. In this case, because I can fit 3 fingers, our patient is medium. If you suspect that your patient is gag sensitive, use your finger and insert it into their cheek. If they can tolerate this, then they're good to go. When introducing the Isolite posterior mouthpiece to your patient, show them that they're individually bagged and guaranteed clean. Opening the bag through the perforation will show you that each of the mouthpieces is designed the same way. There's a throat at the bottom, an integrated bite block, a tongue guard, and a cheek guard. Before placing, lubricate your patient's lips so that it makes it easier to insert the mouthpiece. And then also lubricate the back of the mouthpiece once it's been mounted on your system. When you place it, hold the component gently, not like a hammer, and then hold the cheek guard gently into the tongue guard, and the motion will be side to side, not front to back. Gently insert it into the cheek or buccal vestibule, keeping the cheek guard out, and driving the bite block at least to the midline of your patient's mouth. Draw the bite block down, have your patient bite, and once it's set, gently tuck the cheek guard in, and then scoop the tongue guard lingually. To remove the mouthpiece is a matter of taking the bite block, driving it into the cheek, and then gently pulling it straight out. When you're done, discard the mouthpiece. Several tips and tricks regarding gaining more access in the mouth include this. If you need more room, you can always take the bite block and push it back 1 tooth distally to give you several more millimeters on the lingual and give you more access to the inside of the mouth. In addition, if you want more access on the buccal side, you can actually bring the bite block up 1 tooth towards the anterior, and it'll close the mouth slightly but enable you to retract the cheek much more, giving you more access on the buccal side inside the mouth. You can also turn on and off or manage the amount of evacuation. The bite block will be evacuating through and enabling your patient to eliminate any fluid or debris that may have gotten through the mouthpiece. Remind them that they can use their tongue to eliminate that fluid and drive it to the bite block and become evacuated outside of the mouth. Once you're done, you can turn your evacuation down and you're good to go. If you need more room on the lingual, you can tilt it slightly, giving you more access on the lingual, and the converse in the event that you need more room on the palate of your patient. So there are numerous ways that you can manipulate the posterior mouthpiece inside your patient's mouth to gain more access and give you more room.